All right, everybody, we're gonna go ahead and get started here. My name is Jason Sneed. I'm the Research and Communication Specialist with the Arizona Developmental Disabilities Planning Council. Today we're having the second part of our legislative preview with the esteemed Jon Meyers. We also have live ASL interpreting, so I'll try to speak slow and make sure that if you have any questions that you speak slow so that we can interpret it. We do have, unfortunately, we do not have live captioning, but we do have auto captioning available. So, let's just remember to be kind and nice and try to be respectful. So, with that, I'll turn it over to Jon Meyers to get us started.
All right. Good afternoon, everyone. Thanks for joining us this afternoon. For those of you who were here for our legislative overview back in January, we thank you for joining us again. For those of you who are new, we appreciate you joining us today, and hopefully this information will be of some value to you. I want to point out from the outset, if there are things we miss, if there are things we don't cover today, and we, for some reason, can't get to a question you might have, we always welcome your input. We welcome your follow-up with us. We'll be happy to spend as much time as necessary to talk with you about policy-related issues that touch the disability community in Arizona. So don't hesitate to contact us. And my contact information will be provided at the end. You probably have some contact information if you were able to register for the event. However it comes to pass, please don't hesitate to be in touch with us. I want to start off. And again, for those who were here before, who are familiar with the Arizona Developmental Disabilities Planning Council, I apologize. We want to start off by giving a little bit of an overview of who we are and what we do. The Arizona DD Planning Council is one of 56 councils located in every state and territory of the United States. We are established by federal law, by the Developmental Disabilities Assistance and Bill of Rights Act. We are sister agencies with the protection and advocacy organizations. In our case, it's Disability Rights Arizona, formerly Arizona Center for Disability Law, as well as the University Centers for Excellence on Developmental Disabilities, the Institute for Human Development at Northern Arizona University, and the Sonoran Center for Excellence in Disabilities at the University of Arizona. All of us were established by the DD Act. We all are federally funded entities, and we all are responsible for serving the disability community, in our case, the intellectual and developmental disabilities community, doing systems change advocacy representation on behalf of people with IDD to ensure they enjoy the highest quality of life, the greatest opportunity in their communities, and the greatest inclusion in their communities in the form of self-determination and self-direction in their lives. So in a nutshell, that is what we do. We work very closely with other disability organizations, whether they be advocacy organizations, service providers, or caregiver organizations. We are very closely aligned with groups around the state of Arizona, and fundamental to what we do is the notion that individuals with disabilities should, to the greatest degree possible, self-determine the course of their lives. So self-advocacy is really a fundamental part of what we do. I want to start off again talking about something that I touched on in our previous session back in January, and that is some of the key issues that we're facing here in the state of Arizona when it comes to the disability community. System funding is always a challenge. It has been for years in Arizona. That hasn't changed. There have been some bright spots along the way, but it continues to be a massive challenge for the disability community, and one that is not likely to be overcome in the near future, although steps are potentially being made in the right direction. Caseload growth. Arizona is a very attractive place to live. It is a place that many people move to because the DD service system is fairly generous in Arizona. It is a good system, has been from the outset, and although it's not perfect, it is one of the best systems in the nation by a number of different measures. So we see caseload growth on a consistent annual basis in Arizona. Network adequacy is a challenge, and by that I mean the ability for people in various parts of the state to access the services to which they're entitled, for which they're eligible. in many places, especially isolated and rural areas, it is very difficult to find providers for all of the different services that people might be eligible for. And similarly, there can be challenges with finding healthcare in certain communities, a whole range of issues related to the DD service network and its adequacy in communities. Even in large communities like Phoenix or Tucson, it can sometimes be difficult to find the providers and the services that a person needs and is entitled to receive. Then there are issues of health and safety. We've touched on this in many different venues over the last probably 6 or 7 years, the issues of health care, and then the issues of personal safety. We think back to the Hacienda healthcare incident in late 2018, the issues of abuse and neglect of individuals with disabilities, issues around personal safety and bullying, things like that. Those remain big challenges, even though certain steps have been made, even though certain legislation has been passed to help increase safety, they remain significant challenges. And I'll talk about some of the ways those things are being addressed through proposed legislation in the current legislative session. And then around transition and employment. And I want to be careful when we use the term transition here. We're talking about transition from the public school system into adult life, into post-educational life. We all know that in this particular environment, there are certain terms that some people consider to be loaded. Diversity, equity, inclusion, transition. They have various meanings. In our sense, the word transition relates solely to transition from education to the post-education environment or to the higher education environment. Employment of people with disabilities continues to be a challenge. Some great steps forward have been made on this front, but there's a lot of room still to grow, and we are fundamentally committed to ensuring the greatest employment opportunities, competitive integrated employment for people with disabilities in Arizona. At the federal level, if you've paid any attention at all to the news over the last 3, 4, 5 weeks, you know that the challenges are abundant at the federal level. Some of the proposals being made in Congress right now to change the way services are provided, to change the way funding is provided, to adhere to certain priorities of the new presidential administration, some of those things could have a very dramatic effect on the disability community across the nation, and Arizona is not excluded from that. So many of the things that are being proposed, one of which around Medicaid, I'm going to talk about at length in just a few minutes, many of these proposals could dramatically change the way services are provided and even the ability of people to access services in places around the country. So we want to pay particular attention to those. We want to make sure that we are taking action on those as appropriate, that we're letting our elected officials know where the disability community stands and why maintaining disability services are so important in our communities, large and small. What we're seeing in the current legislative session, which is about halfway through, this week that we are in now is what's considered crossover week. When they call it crossover week, they mean that the House of Origin, the Chamber of Origin of legislation, whether it's the House or the Senate, they've heard as many bills as they are going to hear from their own members. The Senate has heard all of the Senate introduced bills. The House has heard all of the House introduced bills that they're going to hear. And now the ones that have passed committee will cross over to the other chamber. House bills will go to the Senate, Senate bills will go to the House. It's important to note that a minority of the bills that were introduced were actually heard and passed in committee. So the majority of bills that were introduced either never got a hearing or failed in committee and therefore will not be crossing over to the other chamber. That's important to note, and it's true in every legislative session. There were more than 1,800 bills, resolutions, and so forth introduced in this year's legislative session. Somewhere in the neighborhood of 500 to 600 of those will actually go to the other chamber for an additional hearing. And even when they reach the other chamber, many of those will not be heard, and so they will die, even though their House or their Chamber of Origin supported the bill. It can be confusing. It's certainly a kind of a Byzantine process sometimes, but it's important to note that many of the bills that were introduced will never get to the other chamber, and many of the bills that passed one chamber will never get heard in the other chamber. The themes that have sort of emerged, and this is very general, but the themes that have emerged this year in our legislative session, no surprise, issues around funding of the DD service system. I'll talk in a little bit about one of the crises that's being faced by the DD service system, one of the more immediate crises, and then some of the long-term issues as well. There are also a number of proposals related to school safety. And this is not only specific to the DD community, but it involves the DD community to a large extent. There are issues around campus safety, the need for more resource officers on campus, for example, or better crisis or emergency planning for the K-12 service system, the K-12 educational system. And then there are issues around abuse prevention. There is an awareness that physical and sexual abuse takes place on school campuses, and there are some measures introduced to try and address that and do a better job of preventing and responding to the different types of abuse that can take place on school campuses. There are also, and this is not going to surprise anybody who's been paying attention over recent years, still some grave concerns on the part of some people about the way our election systems and our voting systems work in Arizona. This is shared by many other states. It has been the case since at least the 2016 election and continues to be the case. There are proposals to tighten down on how elections are run in Arizona, to tighten some of the requirements for eligibility to vote. Those are of concern to us because we don't want to see people with disabilities disenfranchised. If they have a right to vote, we want them to be able to vote. Some of these measures could potentially restrict their ability to access the ballot box in various ways. So we'll talk about those a little bit. And then a couple of issues that I'm not going to address in great detail today because they are very complex and we just don't have the time to go into any detail on them. Issues around diversity, equity, and inclusion, DEI or DEIA, diversity, equity, inclusion, and accessibility. On a federal level, on a state level, just about every state is dealing with these issues. You know, again, when we talk about loaded terms, these are terms that are thrown into the mix. We know that the current presidential administration is seeking to do away with all DEI or DEIA related programs that fall under any federal umbrella. There are proposals here, even at the state level, to outlaw essentially DEI or DEIA education and training in the workplace, at least in the state employed workplace. Again, I'm not going to go into a lot of detail on this, just as I'm not going to go into a lot of detail on sexual orientation and gender identity. But I do want to say we work in a field, we advocate for people who represent diverse populations. They just represent a lot of different backgrounds. They come from a lot of different places. They have a lot of different cultural aspects to them. So it is difficult for us to talk about the work we do without using the terms diversity, equity, inclusion. We're about maximizing inclusion of people in their communities, but we have to be sensitive to some of the changes that are taking place, and we want to be sensitive. That being said, we will never relinquish our commitment to serving multiple communities, to serving a broad array of people, to serving people from these variety of backgrounds and variety of circumstances. We don't do any specific work in sexual orientation and gender identity, but we do know that there are a large number of people in the disability community who identify in various ways. And so we want to be cognizant of that and sensitive to the choices they make or to the circumstances they find themselves in. There are proposals in the legislature this year that address these issues, not always in a way that we might personally find positive or constructive, but they are there, and it's one of the reasons why, as individuals, we need to advocate with our legislators either for or against the measures that are being proposed. Among the key issues, and I've mentioned this already, perhaps the one that is most central in the minds of members and caregivers right now, as well as provider agencies, is the financial challenge being faced by the Division of Developmental Disabilities. Once again, if you've been watching any of the legislative activity over the last several weeks, if you've been reading news reports over the last several weeks, you know that the division is facing a potentially very, very large financial shortfall. Something on the order of $122 million short of what it projects its needs will be between now and the end of June 2025. That's a large amount of money in a state like Arizona. In some states, I don't ever want to imply that that's a small amount of money, but in some states it's a much lower, it's a much smaller aspect or a much smaller element of a state budget. In Arizona, it's massive. There have been presentations made to the House and Senate Appropriations committees over the last couple of months, outlining why this has come to pass, and there are a lot of reasons. In my slide earlier about the challenges being faced by Arizona, I mentioned caseload growth. That is certainly one of the reasons why DDD faces the challenges it faced. The initial projections for this current fiscal year's budget fell far short of what the actual need is likely to be. There are other issues as well. It's just costlier to do business in the disability world in Arizona. There have been multiple minimum wage increases in recent years. There have been challenges related to inflation. There have been difficulties finding an adequate number of direct support workers, direct care workers, and that has increased the cost for providers. And one of the things that has sort of become the punching bag in this fight is the Parents as Paid Caregivers program. It has taken a lot of heat over recent weeks from folks in the legislature as being a program that's out of control, that is costing far too much and should be done away with or should be curtailed. It is our perspective that that is just one of many causes for the current issue, the current funding issue at DDD. And I think DDD feels that way as well. There are a lot of different reasons why we are at this point, not to excuse anyone, but also not to point the finger at anyone. We are in a situation that needs to be resolved. And right now, the legislature and the governor's office are in a bit of a battle over who's going to resolve the issue. What's happened, unfortunately, as the governor's office and the legislature lock horns over this is that the caregiver and member and provider communities get caught in the middle. So the people who rely upon services or who rely upon payment in order to provide services to the community are the ones most at risk of losing out in this, and they are the ones really at loose ends right now to know what's going to happen. There was talk several weeks ago in the House Appropriations Committee about allowing the DD system, allowing DDD to become insolvent to the point where it could not pay its providers, where it could not reimburse them for the services they provide, and allowing individuals, children and adults, to go without services for a period of months before the new state fiscal year begins on July 1st. Now, we've received assurances from a number of different sources that the legislature and the governor's office will not allow that to happen. They will make sure that the DD service system is supported, that it has the funding it needs. But the flip side of that is that no one has really put forward a proposal for how to do that. And so it's left a lot of people hanging. It's left a lot of people with concerns and with questions. And tomorrow down at the Capitol, there will be a disability day at the Capitol tomorrow. And in the afternoon, a group of advocates, primarily caregivers and members, will be hosting a rally on this very issue to try and encourage every player involved, all of our policymakers, all of our elected officials, to come together and find a solution to this issue so that it doesn't drag on, so that there is some certainty and people can feel confident that the services they rely upon are going to continue to be provided without interruption for the remainder of this fiscal year and well into the future. It is, I call it the elephant in the room. It is the thing that is most on the minds of the DD service system and those who receive services from the DD system at this current moment. Switching gears a little bit, let's talk about some of the legislative proposals that have come forward in this session, and primarily ones that touch upon the DD community. We'll start with the ones that didn't gain any traction, that have sort of disappeared. I mentioned this in our previous session, there were a couple of bills introduced around assisted suicide or end-of-life decision-making, as it's sort of euphemistically called. Both were introduced by Democrats, one in the House, one in the Senate. They were companion bills. Both of those never even got a hearing this year. Not surprisingly, these kinds of bills have been introduced in the past and typically have died before either in committee or before they got to committee. Now, why is this important to the disability community? Well, because historically, individuals with disabilities have been at a great disadvantage when it comes to making decisions about their own lives. And a lot of decisions made for them have either taken away their rights to determine the course of their healthcare decision-making, or have, in many cases, ended their ability to make any decision at all about their lives. So many, many decades ago, there was a eugenics movement in the United States, as there was in many other countries. Fortunately, we're not in that place today, but we're concerned that when it comes to end-of-life decision-making, we don't want the right to make decisions taken away from people with disabilities. And with assisted suicide laws, we believe that there is that opportunity for that decision-making to be taken away. So we're very, very careful about issues like this. So far, the state has never passed a bill related to assisted suicide. And I mean, personally, I don't think we are likely to in the future, but it is always a possibility. There was a bill introduced around access dental care. That one died as well. This is a bill introduced by a Democrat. There is another bill introduced by a Republican that I'll touch on in a minute that is proceeding around dental care for the access population. This is important because a great many people who have developmental disabilities and receive access are not on the Arizona long-term care system, are not even necessarily receiving DDD services, but they need the kind of care that comprehensive dental services would provide. There was a bill around psychiatric conditions and making psychiatric conditions an eligibility criterion for access. That also did not receive a hearing and has died. And then one that we thought would be a great addition in Arizona was a school mental health professionals academy. That unfortunately did not receive a hearing, and so it is not going to move forward. The issue of mental health and developmental disabilities, I should point out, is one that is receiving more and more attention. Despite the fact that this bill didn't move forward, it's a critical issue for the DD community because so many individuals who have a developmental disability or an intellectual disability also have a co-occurring psychiatric condition or mental health diagnosis. And so we want to make sure that the state is providing the highest degree of care possible. And to be honest, behavioral health services in Arizona are still lacking in a great many places. Behavioral health professionals who understand how to work with people with IDD are at a premium in Arizona. And so we would like to do everything possible, support every measure possible that makes sense to provide greater behavioral health care for the IDD community. There was a proposal to include Prader-Willi syndrome among the qualifying diagnoses for developmental disabilities. That also did not receive a hearing this year. Several appropriations bills related to DDD funding. HB 2816 was introduced by Representative Nancy Gutierrez. That would have provided the funding needed, the $122 million needed to support the system for the remainder of this current fiscal year. That bill did not get heard. Representative Gutierrez tried to introduce what's known as a hostile strike everything or a hostile striker attached to a different bill. That amendment, that striker amendment, was defeated. All of this is very inside baseball. So if it doesn't make sense to you, I apologize. But the long and short of it is that several attempts have been made to try and get the funding, the supplemental appropriation that's necessary for the DD system introduced and passed. All of those so far have failed, and that's why we continue to face that DDD funding crisis. Several bills related to voting and to other appropriations, to the Empowerment Scholarship Accounts program for children with disabilities. All of these measures have failed to get any traction. They may have gotten a hearing, but they never passed out of committee. And then I don't want to forget, because our legislators occasionally have a sense of humor, I don't want to forget the bill that was introduced by Representative Volk to make the word howdy the state greeting for the state of Arizona. You may be familiar that Arizona has a state planet, which is Pluto. It's a planet which isn't a planet, but we have a state bird, we have all kinds of official state symbols. Representative Volk wanted howdy to be the state greeting. Unfortunately, that bill never got a hearing. So we, I guess, can continue to say howdy to each other, but it won't be in law that that's our state greeting. Now, on to things that do have some legs and are going to move forward. I mentioned school safety is a big issue. A number of Republican bills have been introduced to increase school safety, whether that is through the development of better emergency planning for individuals, for students of all types, but including individuals with disabilities, or it's some other kinds of school safety planning around crisis response or emergency response. The bills that were introduced, Representative Gress, Matt Gress, he's a Republican. He's a former school teacher. He's the chair of the Education Committee. Has a strong commitment to the education system in Arizona. He's introduced a couple of bills this year around developing better planning within the K-12 school system for emergencies, and what matters to us. His proposals require that the needs of students with disabilities be taken into account. And this is really important. Last year and the year before, some measures were passed that require schools, when they do their emergency operations plans, to take into account the needs of students with disabilities. But there's a very weak enforcement system on that. It's unclear exactly who is required to make sure that those things happen. And with about 1.5 million different school districts, I exaggerate, but with hundreds of school districts around the state of Arizona, and primarily local control over all of those school districts, it is very difficult to ensure that the measure is actually being put into effect. So some of the proposals that were introduced this year will go farther in ensuring that the needs of all students, and most importantly for us, the needs of students with disabilities, are considered when emergency plans are being put into place. The bill introduced by Representative Carter would require that students with disabilities who apply for special education services and need an evaluation for those are given a time frame in which that evaluation will take place. In many cases, evaluations are necessary, but the process drags on. It takes a great deal of time for them to be completed. This requires that schools and school districts provide a specific time frame or a justifiable reason why the evaluation process will take longer than that time frame. We think that's a win for students with disabilities. Also around public safety, I mentioned earlier the issues of abuse, whether it's sexual abuse or physical abuse on campus. There have been a couple of bills related to that. The most important, I think, is the one that Senator Miranda introduced, kind of colloquially known as Ava's Law. This is a bill that was introduced last year. It passed both chambers, but the governor vetoed it because of some challenges in the way it was designed. This is a bill that would hold public entities, and most specifically school districts, liable when situations of sexual abuse or sexual violence occur against a student perpetrated by an employee of that school district or potentially other public entity, if the school district or the public entity has not done a sufficient background check on the person they hired. It stems from an incident that happened several years ago. A young woman with IDD was repeatedly sexually violated by a staff member of the school. That person was prosecuted and is now in jail, but it was determined that the school had not done its due diligence in doing a background check on that individual. And so this law seeks to tighten up, or this bill seeks to tighten up the law around what the penalties are if public entities fail to do that kind of background check. It has bipartisan support. You can see it was introduced by a Democrat. It has made it through the process, is continuing through. It is now crossing over to the House and is likely to continue to have bipartisan support. We'll see if the revisions made to it are enough to satisfy the governor's office, if it lands on the governor's desk, and if she's willing to sign it this year. Some other proposals, again, some companion bills to things that were introduced in the House that were also introduced in the Senate, relatively identical bills, just kind of covering their bases, making sure that both chambers get a chance to hear these things. A bill around graduation rates introduced by Senator Farnsworth. Federal law says that, and many of you may know, federal law says that individuals with disabilities who are on IEPs, if it's deemed appropriate, they can continue to receive public education services up to the age of 22. Again, if circumstances warrant. Sometimes that law is well applied, sometimes it's not. This bill would seek to codify it in Arizona state law, would seek to tighten up the understanding around that and the circumstances in which a child could be graduated earlier than the age of 22 or could partake of those education services until the age of 22. All of these bills that I'm talking about now are in fact crossing over to the other chamber, and because most of them were introduced, I'm not getting political here, it's a reality of the situation, because most of them were introduced by Republicans, and the Republicans control both chambers of the legislature right now. They are likely to receive favorable audiences when they cross over to the other chamber. But again, as I mentioned earlier, that's not a guarantee. They may face some roadblocks when they get to the other chamber. It happens every year. There's no guarantee that all of these bills are going to ultimately land on the governor's desk for her signature or veto. Around elections and voting, I mentioned earlier that we want to make sure that people with disabilities who are eligible to vote have the right to vote, are registered, and can take advantage of that right and registration. Some of these bills are a little concerning to us. I'm not saying they are bad bills. I'm saying they could potentially offer some challenges to people with disabilities. And so we are keeping an eye on them. We encourage you to take a look at them as well. And if you see that they could potentially place some roadblocks in the way of people voting, we would encourage you to contact your elected officials or the sponsors of these bills and express your opinion. There is one in particular, House Bill 2154, that would require any ballots that are returned to the county recorder's office as undeliverable to automatically result in the individual the ballot was sent to being placed on an inactive voter list. The same is true of House Bill 2005. They're different bills. There's some different language in them, but essentially they would make it easier for county recorders to make certain registered voters inactive, and then it would be the onus would be on the voter to contact the recorder's office and reestablish or clarify the situation around which they couldn't receive their ballot or they were deemed inactive. So these, for people with disabilities in particular, can prove burdensome, can make it harder for people who either don't have the communication skills or the communication ability, people who live in isolated areas and maybe don't have access to a recorder's office, whatever the case may be. It could potentially be much harder for them to make sure that they are maintained on the active voter lists. Issues of eligibility and funding for the DD service system I mentioned earlier. DD funding is a challenge in the best of years. There fortunately are some bills being introduced this year that might make it easier for people to move through the process, make it a little less burdensome for them. House Bill 2174, I talked about this on our earlier session in January. This would allow people to bypass the DDD eligibility process and go directly to All-Tex. I want to be clear, this is not a bill that makes that in any way diminishes the standards for eligibility. It just reduces one of the bureaucratic hurdles. There are some questions around this bill, and there are likely to be some amendments around this bill as it moves forward, but it is intended to lower some of the bureaucratic burden on individuals who are seeking All-Tex eligibility and potentially lower some of the costs to the state for this process. There's a bill introduced, I mentioned Representative Gress earlier, a bill to address how applied behavioral analysis is reimbursed, how providers of that are reimbursed in the state. This one's a little bit troubling to some members of the DD community because there is right now a rate differential. If an ABA is provided in a facility, it is reimbursed at a certain rate. If it's provided in home or in the community, it's reimbursed at a slightly higher rate because of the travel expenses and other costs associated with taking the provider to the individual who needs the ABA therapy. This would do away with that rate differential, and it would set the rate level for all providers regardless of the setting. Some ABA providers in particular find that to be troubling because their argument is it's simply more expensive to take things into the community as opposed to having everything done in a facility. So there are some arguments against this, and we'll see whether this is amended or falls short as it moves forward. A number of appropriation bills. Representative Willoughby has introduced an appropriation bill for access funding, not strictly speaking for the DD service system, but would likely have some impact on DD services as well if the money goes to access. Senator Fincham, who by his own admission is nobody's idea of a liberal, has introduced a very generous funding bill for DDD moving into the coming fiscal year. Senate Bill 1302 would add $45 million in state general fund and $88 million in federal spending authority to the DD service system. It doesn't cover the full need, but I want to be clear, this would be as of the 2026 fiscal year, starting on July 1st. It wouldn't touch the need for the remainder of this fiscal year. But this would be a significant addition to DDD's current funding. Doesn't meet the full need, which is somewhere in the neighborhood of 150 million state dollars and about 450 million federal dollars, but it would make a sizable contribution to moving us toward that need. Senator Fincham takes the opinion that government has 4 primary purposes, among them education, public safety, and I apologize, I can't remember the third, but the fourth being taking care of the most vulnerable residents of a state. And he considers the DD population to be one of the most vulnerable populations in Arizona. So he would like to see more funding dedicated to this system. Some other issues I mentioned, that there is a dental bill moving forward that is essentially the same as the Democratic bill that failed, and then some other all-tax rate increase bills. The thing to remember about all of these appropriation bills, and not to belabor it too much, is they may pass committee, they may pass a Health and Human Services committee, they may pass an Appropriations committee, but ultimately they all get bundled up with the overall state budget negotiations. So even if the legislature says this is the amount of money we think should go to a particular program or a particular department, ultimately that can change when the state budget negotiations take place, because everything has to fit within the available resources for the state. So lots of different things come out of the wash a little bit differently than when they went in. Some miscellaneous stuff that I want to touch on. There is a bill introduced this year by Representative Willoughby to allow drivers and owners of motor vehicles to voluntarily disclose when they apply for a driver's license or automobile registration that they are a person with what is termed a communication challenge or a need for alternative communication. This is something that's been tried in other states and has worked fairly effectively. It's meant to give law enforcement an additional tool when they interact with drivers with disabilities or approach a vehicle of a driver with a disability. This information would never be disclosed on the person's license or on the person's registration, but it would go into the it would go into the public transport and public safety departments records, their computer systems, so that a law enforcement officer could pull it up on their terminal in their vehicle when they pull a vehicle over. This is moving forward. It is. I feel confident that it's likely to find support when it moves to the Senate. And personally, I think it's a good bill. It is an entirely voluntary process and could support law enforcement. One thing I would note is we think this needs to be combined with better law enforcement training, and law enforcement officers feel the same way. So it's not an ideal bill. It's not a perfect solution for interactions between people with disabilities and law enforcement, but it is a step in the right direction. Some other bills, a couple of bills that relate to secure behavioral health facilities. Again, the issue of behavioral health is one that's important to the DD community, and there are some issues with some of these secure behavioral health facility proposals, because the last thing we want to see is people with IDD and a behavioral health diagnosis locked up for long periods of time and potentially not provided the appropriate kinds of support and care they need. And so we're watching these bills very closely and weighing in on problems or problematic areas we see in them. The group home monitoring program that is currently being operated by Disability Rights Arizona, that was funded for a 3-year pilot program, that 3rd year is coming to an end soon. Senator Dunn has introduced a bill to extend that program in perpetuity. That just passed the Senate Appropriations Committee this morning and will be moving on for consideration in the House. Well, that assumes that it passes the full Senate, but I think that's likely. So that could end up being a long-term program. It's one that we think is very important. We at the council think is very important because it provides an additional layer of oversight and safety for people who live in group homes that serve what are termed people with complex needs. That would be people with IDD and a behavioral health diagnosis. So we think it's a good program. It's done good work so far. And Disability Rights Arizona and DDD work very closely on this program. We think that that partnership will continue to improve even as time goes on if the program is made permanent. I don't want to belabor this because I know time is limited, but I do want to provide to you just a sense of what the governor's office is proposing for funding for the DD service system coming into the next fiscal year. These are slides I provided in our earlier proposal as well. We will be making these slides available to you following today's session. If you have any questions, as I said earlier, please follow up with us. The important thing to note is that the governor's office is proposing some significant new investments in the DD service system. I'll go back to what I said just a few minutes ago, which is what goes into the budget negotiations and what comes out of the budget negotiations may look very different, but this is the governor's office putting a stake in the ground, just like members of the legislature have put a stake in the ground, and they will figure out how to make the two work together in some form or fashion as they go on. You can see that on the issue of serving vulnerable adults, which is not just the IDD population, but is also aging individuals, people with physical disabilities who are aging and so forth. You can see the large dollar amounts that are being proposed for the coming fiscal year. These are additions to what is currently in the state budget. So these are on top of federal fiscal year or state fiscal year 2025 dollars. Specifically for providers of services in the DD service system and the EPD or elderly and physically disabled service system, you can see the governor is proposing about $75 million in additional funds over the course of 3 years for the DD and AZIP, Arizona Early Intervention Program providers. That's a pretty good amount of money. Again, it doesn't solve the problem. And as we heard from the providers recently, it doesn't even meet the needs, the minimum wage increase needs, but combined with potentially other sources of funding that have been appropriated by the legislature, altogether, they could make a significant difference in the ability of the DD system to provide adequate care and meet its own staffing needs and so forth. These are some breakdowns with regard to caseload in Arizona in the DD service system. And this is really more as an FYI. If you're curious about how many people fall within a certain category, I would point out that you look at the Down syndrome number and you think there must be more than 400 people with Down syndrome who are receiving services from DDD. That is true. The reason the number is so small is that Down syndrome was just added as an eligibility criterion about a year ago. And so the number of people who have become eligible specifically because of Down syndrome is relatively small. That number will grow over time. You'll see the number under intellectual disability will shrink because that's where most people with Down syndrome have fallen in the past. You'll see those numbers start to change, one going down, one going up as time goes by. Again, these slides will all be provided to you if you want to take a more in-depth look. But I want to deal now with what is probably next to the DDD funding issue here in Arizona, probably the biggest matter on the minds of people with IDD, caregivers of people with IDD, providers for people with IDD, and that is funding for Medicaid. As you know, Medicaid is a federal system. It is a state-federal partnership. In Arizona, we get about 70 cents for every dollar needed to support the DD service system from the Medicaid system from the federal government. The state puts in 30 cents. The federal government puts in 70 cents. That's a rough estimate. It's a little more nuanced than that, but that's roughly how it works. What's being proposed in Congress right now, what the current administration would like to see, and what certain members of the House of Representatives and the Senate would like to see are massive cuts to the Medicaid system. Now, as a reminder, Medicaid doesn't just provide, or Access is our Medicaid agency here in Arizona. Medicaid doesn't just provide health care for low-income individuals. Medicaid provides the vast majority of home and community-based services in Arizona, whether that be attendant care, habilitation, therapies, day programs, employment programs, a whole variety of different things in schools, in provider organizations, in a vast array of things. Programs that serve people with intellectual and developmental disabilities are overwhelmingly, if they qualify for state services, they are overwhelmingly supported with Medicaid dollars. You can see in this little graphic here the range of things that are supported by Medicaid funding. It is extraordinarily important. It would be impossible for the state to provide DD services to all of the people who need them without the federal investment that comes through Medicaid. But right now in Congress, in the House of Representatives, in a package that is likely to be voted on this evening, there is a proposal to cut $880 billion from the Medicaid system. How can that happen? How could it be possible to continue to run Medicaid without that level, without the level of funding that we see today? Well, the proposals would lead us to believe that the system could be maintained using block grants or per capita caps. With block grants, every state would receive a certain amount of money to use on DD services, and when they or all of its Medicaid services actually, and when it ran out of that money, either the state would have to make up the difference or people would have to go without. Similarly, with per capita caps or lifetime caps, there would be a certain amount per individual allocated, and when that money ran out, the individual would have to fend for himself or herself. Lifetime cap, you can imagine there would be a certain amount of money for a person's entire lifetime, and if their needs exceeded that, they would be out of luck. There could be work or training requirements imposed on people who receive Medicaid services. So if they're not working or not receiving training to acquire work, they might lose out on the opportunity to use Medicaid. Other things, there could be reductions in the amount of subsidies for the Affordable Care Act policyholders. And what it all boils down to is that there would be less money available to every state in the United States, including Arizona. In all likelihood, people would receive a reduction in their services, receive potentially fewer services. It would be more difficult to become eligible for services, and we could see some eliminated altogether. Why is this important? Well, it's probably obvious. Why am I mentioning all of this about Medicaid? Well, the vote is likely to happen this evening on this budget proposal, and it is crucially important that advocates for people with disabilities, individuals with disabilities, caregivers, providers, whomever you are, if you care about maintaining the Medicaid system, it is crucially important that you speak out and make your voice heard on why Medicaid matters to you, why Medicaid matters to the people you love, why Congress needs to continue to appropriate an adequate amount of funding to underwrite Medicaid. I'm not sitting here saying that the Medicaid system is perfect. There are things that could be improved. We all recognize that, but we also recognize that without the services people with IDD receive in Arizona, their quality of life would be greatly diminished. And the quality of life of caregivers would be greatly diminished. We also recognize that without Medicaid funding, if providers have to go out of business, if individuals have to leave jobs in order to become full-time caregivers, there is an economic impact to that. Communities suffer. Reductions in Medicaid funding would force hospitals in rural or isolated communities in all likelihood to close because they rely so heavily upon Medicaid reimbursement. It would require all kinds of programs to suffer or close. It would have a ripple effect on our economy overall. People would be put out of work. More people would have to rely upon public assistance if it's available. Businesses would no longer be able to sustain themselves. There would be an enormous ripple effect throughout the economy in communities large and small in Arizona. So what we're encouraging you to do, if you haven't gotten the message already, make your voice heard. Reach out to your elected officials, in particular, your member of the House of Representatives or all members of the House of Representatives representing Arizona. Let them know why Medicaid matters. There are some resources here, some sites that you can visit. If you don't know who your representative is, the Find Your Representative tool on the House website is great. Takes virtually no time at all. You can plug in your zip code and it will tell you who represents you. And then there's what's called the Hands Off Medicaid hotline. If you just want to call that hotline directly, it will allow you to plug in the information you need and connect you directly with your representative's office. I can't say it enough. The vote is likely to happen this evening. It's not too late to make your voice heard. Please make that call. Let your representative know why Medicaid matters to you and why you believe funding for the Medicaid system should be preserved, and let them know that you're thinking about this and you're thinking about them. Additional advocacy actions you can take. By the way, I don't want to gloss over other things that are happening at the federal level. The reality is there are lots of things happening that are troublesome to a lot of people. There are different perspectives on how the federal government should operate, how large it should be, and so forth. We respect the points of view of different people. We as individuals may not always agree with them, but we see a lot of things that could have troubling impacts on the disability community. Proposals to eliminate the Department of Education, proposals to make changes in the way that the Department of Health and Human Services operates, on the availability of research, and in particular research on vaccines, healthcare, and other research related to the disability community. We encourage you to make your voice heard, just as we as an organization make our voice heard on these critical issues. We are not lobbyists. We do not take a stand on particular bills, but when we see challenges, we do share our feelings about the way those things can be addressed with our elected officials. You can speak out and you can speak your mind. And the more our representatives hear from us, the more our senators hear from us, the more they will respond, the better they will respond. Some additional ways you can advocate on behalf of people with disabilities. You can sign up on our ADDPC email list. You can receive our newsletter and our advocacy alerts. If you're a self-advocate in particular, Arizona Achieve is a statewide network of self-advocacy organizations serving people with IDD in Arizona. Go to the Arizona Achieve website and learn more about their programs and how you can become involved. Even if you're not a self-advocate, they do a regular listing of policy updates. It's a great resource. It can keep you abreast of things that are changing on a daily or weekly basis here in Arizona. You can share your story with your friends and your community members. You can, as I've mentioned a number of times now, you can contact elected officials here in the state and at the federal level. You can make them aware of why things like Medicaid, things like education services, why those things matter to you and to the people you love. And if you're up for it, you can testify at the legislature. Arizona's legislature is very welcoming when it comes to testimony. There is a system you can use called the Request to Speak system. I said on our last call that it's a great system for making your voice heard. It's not a great system. It's an adequate system. It's the best we have, but it is the only one we have as well. Use the Request to Speak system, establish an account, use the Request to Speak system, and make your voice heard at the legislature. Whether you testify or you just submit your opinion on a bill, use that system. It is one that legislators pay attention to. Finally, last slide, just to give you a sense of our priorities here at the DD Planning Council, the things that are important to us. This is not an exhaustive list, but these are the things that we are working on every single day, where we have some degree of expertise, or we collaborate with people who have expertise in these areas. If you ever have questions about these issues or other issues, or these priority areas or others, feel free to contact us. We would be more than happy to talk with you, more than happy to connect you with people who can assist you. Whatever assistance you need, it's our job to be here for the community. It's our job to assist, and we would be happy to do so. So that's a lot of information in a relatively short amount of time. Please forgive me for the amount of talking I've done. I am more than happy to answer some questions if you have them. And I've not been following the chat. So if Jason or somebody else would like to share some of the questions that have been posed, if I can answer them, I certainly will.
Absolutely, Jon. This is Sarah with ADDPC. I'll go ahead and read questions we have in the chat. First question comes from David. David asks, what tools do you use to track legislation related to disabilities on a local, state, and federal level?
Well, the tool, we use a couple of tools. The primary tool we use is one that is affiliated with Arizona Capital Times, which is a local newspaper that focuses on policy issues. The program is called the Legislature Online Arizona, or LOLA. Now, we use that. There is a cost to doing it, and it's not inexpensive, but that's an investment the council makes in making sure we can stay abreast of things. You can also just go on the Arizona Legislature's website, azleg.gov, and you can do searches on the website using keywords, whether it's disability, voting, transportation, education, whatever the case may be. So the Arizona Legislature's website is a good resource. It's more time consuming, but it is free, and it is updated on a daily basis. So that's one I would suggest. There are lots of other tools out there, all of which have a price tag associated with them. So I don't know that I would feel comfortable recommending any one of them in particular, but the one we use most is that Legislature Online, or LOLA system. If you work with an organization and that organization can afford the fee, that's a good one to start with.
Thank you, John. We'll move on to the next question. Shayna asks, isn't it true that there have been gaps like this between the approved budget, this is for DDD, and then the amount needed to fund through the end of the fiscal year, and that the legislature approved money to fill the gap in previous years?
It is
She
true.
wonders if this is a new thing.
No, it's not a new thing. There have been gaps in the past. The projected amount and the appropriated amount have differed in past years. What seems to be the issue, at least as far as the Republican appropriations leadership is concerned, what seems to be the issue for them, the sticking point, is that they feel the governor's office and the Department of Economic Security, which oversees the Division of Developmental Disabilities, they feel that those entities did not communicate with them in a timely fashion when they knew that there were going to be cost overruns or that expenses were going to be greater than appropriations, and that this current situation was more or less sprung on them at the last minute. They feel they were put in a bind, and they were given really no opportunity to assess the situation. They also have expressed that they feel there are some inefficiencies within DDD and DES, some changes that need to be made. I can't speak to those things. I don't intend to speak to them. I'm just sharing what has been put out to the public by members of the Appropriations Committee. In past years, I can only assume that the process worked differently. There was more communication, and the folks who ran the Appropriations Committees felt more comfortable with their stopgap funding. This year, it has really hit a wall. And right now, the governor's office takes a position that these funds are needed and that these families are relying upon them and providers are relying upon them. The Appropriations Committee recognizes that the families and the providers are relying upon them, but they're insisting upon better communication from the governor's office, and they're insisting that the governor's office come forward with a plan to remedy the things the appropriations folks see as issues with the way DD services are provided. So right now, that's where things stand, and nobody's really willing to budge at the moment. Of course, we are encouraging everybody to come together and resolve this situation amicably and to the degree that DDD needs in order to continue operations through the year. You could talk for days probably about all of the various issues and perspectives involved here. But yes, in long and short, in the past, the situations like this have been resolved. I would point out that the situations around DD funding in the past have never been quite as extensive as they are this year. We've never been to the extent of $122 million. And by the way, that's just an estimate right now. It could end up being larger, could end up being a little bit smaller, but it is greater than I think the state has ever seen in the past.
Thank you. How do we know that police officers have had appropriate training to interact with people with disabilities?
We don't. We don't, because most police officers receive a very limited amount of training on interaction with people with disabilities when they go through the academy. And once they leave the academy, in almost no law enforcement agency in the state of Arizona is there a requirement for ongoing training around working with people with disabilities. Now, to their credit, law enforcement agencies recognize this, whether it's sheriff's departments or police departments or the state troopers. They recognize that they have not been given appropriate or adequate training. Many of them have expressed that they would like to receive more, but there is also limited time available to them when they do their annual recertifications. And there are some statutorily required things they have to do. And then there are some electives that they can take. There are elective modules around working with people with disabilities, but very few officers take advantage of those elective modules. We would like to see more required training both at the academy and on an ongoing basis. And we've had these discussions with members of the legislature before, with the Arizona Peace Officers Standards and Training Department. We've had discussions. We have ongoing discussions. We work with law enforcement officers in a number of our initiatives around public safety. Right now, we don't have any assurance that any law enforcement officer has had adequate training. We just know that some have voluntarily gone through crisis intervention training or the modules that they can take, the elective modules. We would like to see something better. As I mentioned earlier, we would like to see that required training be mandated alongside the bill that would allow people to self-identify on their registration or license. But there is not a lot of receptivity, I guess, at the legislature for any kind of new statutes around that at the current moment.
Thank you, John. Do you have any information about changes with SSI coming down the pipeline?
Unfortunately, we do not know of any changes around SSI or SSDI. We're as informed as most of the general public. I could also say we are as in the dark as most of the general public around what might be proposed or what might come out of the Social Security Administration. We are hopeful, we are optimistic. We certainly have plenty of allies who are working on Capitol Hill to try and make sure that the needs of people who receive SSI are respected. But again, our new presidential administration has certain priorities, and they are pursuing those priorities. And we have no guarantee that the system will be maintained as it currently is. But by the same token, I guess I would say we don't have any evidence that it won't somehow be improved or strengthened. We just don't know.
Thank you. We did have a question about group home monitoring legislation moving through and whether it covers IDLAs. It does appear that people answered this in the chat. Do you have anything to add?
The only thing I would add, and I again haven't looked at the chat, but no, the group home monitoring program would not cover IDLAs. It would not cover ADHs or adult developmental homes. It would only cover group homes that serve people who have, again, the term is complex needs. So there are about 500 of those, roughly speaking, about 500 of those facilities in the state of Arizona. And this program would continue to do its annual review of a portion of those. So over the course of several years, it would cover the whole body of those homes. Now, that's not to say that the rules couldn't be changed, that the legislation couldn't be amended in future years so that it was expanded. It just, as written right now, it would continue to just focus on those people who live in people who have complex needs and live in group homes designated for that purpose.
All right, next question. Can you discuss the Autism Cares Act of 2019? I believe $1 billion was approved.
Yeah, I can generally address that. It was considered a big win for the disability community, in particular the autism community, because it provides a massive amount of money for research and for programs that serve individuals with autism or people who are on the autism spectrum. We haven't heard about any move to try and change that legislation or cut back on that funding. We have heard some troubling things related to the new director of the Department of Health and Human Services at the federal level and his attitude toward autism. So we're not ruling out that there could be an effort to change that or curtail that funding. But as it stands now, that funding could be used in a wide variety of ways. It could be used at the state and local level, in particular by researchers to develop better programs, better diagnostic tools, to provide services for people with autism or on the autism spectrum, to increase their community engagement, to increase their opportunities in the community for education, for employment, for a variety of things. It was, again, considered a big win for the autism community, and we're very, very hopeful that it will stand up and that those monies will actually be made available to the agencies and educational institutions that can put them to best use.
Great. Okay, I think we only have one or two more questions for you, Jon. Looks like people are thanking you for the information. One person is asking regarding Governor Hobbs, if she's directly connected with this budget situation, why is she so absent?
Well, it's an interesting question. It's one that has been posed to us a number of times. I cannot speak for the governor. I don't work for the governor, and I can only say that she has issued a couple of press releases related to the funding situation. She has stated her position on the importance of the legislature appropriating the necessary funds. She has on several occasions pointed out the connection or the parallel, I guess, between the need for DD service funds and the ESA or Empowerment Scholarship Account program. It seems to be the opinion of the governor's office that that certain aspects of the ESA program, some problematic areas, have been allowed to bypass scrutiny, whereas the DD service system has come under great scrutiny. Her documents are public records, so you can take a look at them. We would certainly love to see the governor more visible on this. And it sounds as though the legislature's appropriations committees would also like to see the governor more visible on this. I assume that will happen in due time. We don't want this to reach a crisis level, although in the minds of some people, it is already there. And so we believe that the governor's office is going to have to come out and be much more visible on this in order to find a solution. That seems to be the only way the appropriations folks will agree to move forward.
Great, that's it from the chat.
Okay. Well, thank you all. Oh, I see one more question regarding the school resource officer bills. If you don't mind me just answering that, one of the areas of concern for us around those bills is that there seems to be a lot of ambiguity related to how personnel will be trained, what kind of training programs they will use, how rigorous that training will be, who approves the training, and so forth. I'll speak for myself anyway. I would like to see some of the language tightened up. I would like to see more specifics around the very things that I just mentioned, such as training and the training resources. Those are not insurmountable obstacles, I don't think. I believe that our legislators will be open to arguments about why those things need to be addressed. If we simply assume that any generic training program for school resource personnel is going to be sufficient to address the needs of people with disabilities, I think we're all going to be very disappointed. So we need to make sure that those aspects are included in the training, and that just requires advocacy on the part of the council and on the part of the community. So if you have concerns about that, I would certainly encourage you to address them directly by email or by phone call with your elected officials, with the bill sponsors. Make sure that they understand why these are essential elements. And I given who the sponsors are, I feel confident they will welcome the input. It doesn't guarantee that they will make the changes we think are important, but they will certainly welcome the input and potentially want to get more information from you and have further conversation.
Wonderful. Thank you, John. And thank you so much, everyone. We appreciate your input. We will make sure to get the slideshow and the full recording of today's presentation out to each and every person who registered, as well as our full email list. If you know someone who needs these updates or you'd like to get more updates as we move through the session, this legislative session, please let us know. You can send us an email at addpc@azdes.gov. Thank you so much. Have a great day, everyone.